All right, more top stories coming right here on the program.
You're also watching Breakfast Central. Let's go to South Africa, where across the continent, countries this week have been marking World Breastfeeding Week, which draws in close tomorrow. Now, World Breastfeeding Week is commemorated annually in the first week of August to show sustained commitment to protect and support and promote breastfeeding as a cost-effective intervention.
Now, the World Health Organization recommends exclusive breastfeeding for the first 6 months of life, but many countries have not been able to meet this goal. Now, in South Africa, data shows that exclusive breastfeeding rates have increased from 8% in the year 2003 to 32% in the year 2016.
But the reality is that South Africa is not on track to meet the global target to improve the exclusive breastfeeding rate of 50% by 2025. Now, joining us this morning to really break this down is dietitian and breastfeeding advocate Dr. Chantel Witten, all the way from South Africa this morning, Bloemfontein. Good morning, Dr. Witten.
Good morning.
Good morning, and good morning to the viewers.
Right. Let's just start briefly with the basics. Just how important is exclusive breastfeeding for the first 6 months of a baby's life?
Thanks, Lucy. Breastfeeding is not only food for babies, but it's also medicine for babies. And so this message from the World Health Organization to support exclusive breastfeeding is to protect babies so that our children are not dying from inappropriate feeding. When you are using anything else other than breast milk, you can introduce contaminants. Maybe the water is dirty. Maybe the food isn't well constituted in terms it's under diluted. And these are all reasons that cause children to get sick and die. So we know that exclusive breastfeeding actually protects children's lives. That's how important it is. It's about child lives.
Right. Now, Dr. Witten, on to South Africa, looking at it as a case study. What are the reasons for South Africa having such low breastfeeding rates? I mean, let's look at the challenges that breastfeeding mothers face in South Africa.
Thanks, Oluchi. The reality is that we can't forget that South Africa had a HIV program, which was the prevention of mother-to-child transmission of HIV. And we provided free infant formula through the health system. So we have a very strong culture of free infant formula for 10 years. So between 2001 and 2011, mothers were very used to getting free formula, and it caused what we call the spillover effect. So even the moms that weren't HIV positive, they started to use formula more because formula was around everywhere. So that's one of the reasons. We also have a very high rate of unemployment. Unlike other countries, South Africa doesn't have subsistence existence. Most of our women work in factories, they work in agriculture sector, they are working women. And so it's very difficult when you don't have a supportive working environment for breastfeeding. So our moms are forced to stop breastfeeding early, put their kids onto alternative feeds so they can go back to work. Going back to work is one of the number one reasons women either don't start to breastfeed or they breastfeed very short. The other reason is that in the context of South Africa, breastfeeding has not had the community drive. We still have very hostile environments for mothers who are breastfeeding. In the last few years, we've seen that moms that breastfeed in public and in spaces like malls or restaurants have actually been asked to leave. So our culture for breastfeeding has not been very embracing.
Well, Dr. Witten, that is quite a surprising one in South Africa. Yes, instant formula, just like you talked about, a huge driving campaign and the challenges of mothers looking to go back to work. So is there a way they can really change that? Because it looks like mothers in South Africa are used to the instant formula. So breastfeeding doesn't look like the first option, does it?
No, it's not usually the first option, but we've made great strides. As Oluchi read, we've gone from 8%, to 32%. So that's a five-fold increase, which means we're doing something right. And I think the things that we are doing right, one, our health system is completely committed to breastfeeding. So all our public health facilities are what we call mother-baby friendly, and those mothers giving birth in a public sector hospital or community health center, they are latched to the baby immediately after the baby is born. So we call this initiation of breastfeeding. They are helped to support breastfeeding before they go home, and they are given support in the community. We call it the peer-to-peer support. So we have the Mother Baby Friendly Initiative. The other thing that South Africa did was it implemented and legislated the International Code for the Marketing of Breast Milk Substitutes. Now, this is a UN code. It was endorsed in 1981. It took South Africa 26 years to get a legal instrument in place to control the marketing of breast milk substitutes. And just this morning, unfortunately, we see that the infant formula companies are still trying to reach mothers and promote their products. So this morning, I saw a headline where one of the biggest infant formula companies in South Africa is actually sponsoring a mother and baby event. And they are asking moms to come and hear about how to feed your baby. So this is unacceptable. This is not how we would like our breastfeeding or our infant and young child feeding to be promoted, not through companies, and not for companies to undermine mothers, not for companies to push products that moms don't actually need. Because the reality is South Africa is a breastfeeding country. We do support breastfeeding at the community level. But when we have companies interfering and sending messages to moms that they've got better products, it is competing. And therefore, as civil society, we have to keep our hand and our collective action in trying to keep the infant formula companies from not engaging directly with moms.
Right. Now, Dr. Whitten, it is a lot you're saying, and it's also not just happening in South Africa, it's also happening in Nigeria and other African countries as well. Now, looking at vaccination, COVID-19 at this point in time, and the fact that South Africa is trying to ensure that a lot of people are vaccinated before the year runs out, is it safe for a newborn to still be breastfed, knowing that the mother has gone or has taken the first shot and possibly the second shot of vaccine?
It's absolutely important that firstly, moms get the vaccination. And secondly, breastfeeding, like I said in the very beginning, is medicine. So all the diseases that the mom has been exposed to, such as COVID, the mother will produce antibodies. And those antibodies will be transferred from the mother into the baby via the breast milk. Those are called immunoglobulins. You don't get it anywhere else. And so this protection is why we are almost asking moms not to give up breastfeeding while they are COVID positive, because as their antibodies are actually the natural form of protection against COVID. So that baby will have natural antibodies towards COVID. And so in the context of COVID, mothers must please continue to breastfeed. They breastfeed safely by wearing a mask, by washing their hands, but keeping the baby close skin to skin and on the breast is the only way that we can protect babies, because we're not vaccinating children. And so for young children, the protection is coming from the mother and through her breast milk.
Well, thank you so much, Dr. Chantel Whitten, yes, a dietitian and breastfeeding advocate, for joining us this morning on Breakfast Central, all the way from South Africa in Bloemfontein. Thanks for your time, Dr. Chantel Whitten, again.
Thank you very much. Thank you.
All right. More top stories coming your way on Breakfast.